Good morning. Good morning. Good morning, everybody. Happy Monday. Yes. It rolled around so fast, didn't it? Didn't it roll around fast? I was like, I think I was just saying Friday, and you know, I'm gonna hopefully this is not going to start talking because I want to share this out because it is so important. So I'm trying to see if I can see myself and do some sharing because as I said, this broadcast, if you saw, oh, guess what, you all, I'm not on the right page. Probably why I don't see myself. Yeah, give me a minute. I'm sorry. I'm very, very much into what we're going to be talking about today. So I definitely want to make sure that I share it out and want to make sure that people are going to be able to find this broadcast. But I think I might have to share it later because it seems like not into it today. Nevertheless, hey, I'm Angela McGowan, your professional healthcare advocate, caregiver strategist. I'm the author and publisher of How to Get Out of the Hospital Alive. I see the ring light in my eye. I was trying to give myself more light without, yes. How to Get Out of the Hospital Alive, that book. And I am the, and here this is bringing up, I am the founder of Angie's Pace, as patient advocates committed to excellence. So good morning, happy Monday. And I'd love for you to come and be a part of the broadcast. You can certainly come to StreamYard, and that is the code that you could use if you'd like to add, or if you even have questions while we're online, you are certainly welcome. So let's talk about it. It's July 1st. That's right. This is reset. You can reset and actually begin again. Okay, it's just like New Year Part 2. This is wonderful. And everybody doesn't get an opportunity to like just start over. And well, let me say this. Everybody doesn't take advantage of the opportunity that we all have right now to start over, to begin again. It's a new day. It's Happy Monday. It's the beginning of most people's official work week. You know, Sunday's the beginning of the week, and some people didn't have to work Sunday, but they are there today or going on their way, or maybe even coming back because it started yesterday. But wherever it finds you, remember it's July 1st. You can start again, you can begin again. And so I want to talk to you about what July 1st represents in different areas of our lives. First of all, many of you beginning today, your healthcare choices and changes go into effect. Most people, now this is excluding those with Medicare who made their choices in October last year for January this year, okay? Excluding that. Probably in May, you began getting packets, or maybe you had health fairs, or something was sent to you via mail, digitally, email, print, about the opportunity, right, to change your physician, change the where you went to the doctor to see that physician, maybe to change ER visits or co-pays, a lot of things, you know, you have the opportunity to do. In May, um, for June is usually the deadline, and then everything takes in effect on July 1st. Now, here's the question. It's a minor question. No, it's not interrogation, it's a question. Here it is. Do you or can you verify that your choices have taken effect? Simple question. Are you sure? Yes, you are. You're sure of your co-pays. You got another card, right? For the PCP and for the specialist. You know that because it says it right there on the card. Of course, you're straight. Are you clear about the urgent care? Like, did that change? What about the ER facilities? Can you go to more or less? You have those co-pays increases, right? These are just things to think about. Nothing, you know, I add just questions because we're resetting, right? It's a reset. But now this, another question. How sure, how confident are you about this year's exclusions? What? Yeah, exclusions. Yeah, those are part of the new healthcare year, the reset by your healthcare provider, by your insurance company. Hmm. Yeah, exclusions of specialists, exclusions of services, inpatient, outpatient, exclusions of labs, exclusions of imaging, exclusions of medications. Exclusions are a part of the reset. I hope it's not a surprise. I hope that you don't get the revelation of these exclusions the day you need them. Where were they anyway? Like, where do you find exclusions? It's not on the little healthcare insurance card. No, it's inside your healthcare portal. You know, they used to send that huge book out, the one we just didn't even open up out the packet. We got the little small books, but the huge Big Daddy book, we didn't really open that book. And so now to save trees, no, to save millions and millions of dollars, it's in your healthcare portal. They mail you a card. Some people don't even get a card. They have to go to the portal to print the card. Okay. So inside that portal, way to the back, like the last tab, that's where you're going to find exclusions. Yeah. Those exclusions are there at the beginning when you resign so that you can have the opportunity to say, I can't go to this doctor because they're excluded. Like some people, they don't have to have referrals, but they pay a higher price if that medical group is not inside of their network, the out of network costs. And this might be new. Or maybe they can absorb the network costs if they have a higher premium. But those things are usually found out when you need that specialist the most, when you need that service the most. I'm asking you to go and check it out because I do know that there are times, depending, when you may be able to go and still make amendments. You may still have the opportunity. It's July 1st. You may still have the opportunity. And if you can't change it, at least you're aware of it so that you can begin to build a backup plan so that you know that if you go in the hospital, you're not going to have the $50. No, you're going to pay $500. Isn't that something to go to the doctor, have all your pre-ops, and then on the day that you're about to check in, even if it's the same day, someone asks you for $500? I know people that has happened to. After they pay for someone to come from somewhere else to stay at their home and did all of that, then they find out they're $500 short. Somebody needs to come up with that $500 if you're having surgery today. Speaking of coming up with money, that's my topic today. We're talking about today's July 1st. Something else is done. This is not a reset. This is the regular. What? Your lease, your rent, your mortgage, something is due on the 1st. Now you have a little gravy, depending on where you are. It might be all the way to the 3rd, all the way to the 5th, all the way to the 15th. But July 1st is the day. So let's talk about the $400 choice. This is not something I heard about. It's something I know about. It actually happened. So let's talk about it. All right, so listen, all of us know about parents that are taken to court by doctors, by relatives, by social workers for not giving medical care or giving meds to their child or children. These entities, doctors, relatives, actually go to court and plead the case for the child. What's the next thing we know? CPS can have children removed from our care, your care and my care, if we don't follow through with life-saving medical attention. We may be asked to come to court to justify what we say we do or do not want, what the child should or should not have. Definitely. So let me tell you about a case that I worked with regarding medications. So there's a child that had a specialty med. When children have medications, they definitely have to be monitored, for any side effects, to make sure, not just side effects. Doctors are very, very wise in this, and maybe it's insurance coming out with them, to make sure that your child is getting the medication that has been prescribed. They do labs, and if a certain amount is not showing up, that means the parent or whoever is responsible is not giving it. So therefore, the child is not getting the care that they need. And it's going to be called to that parent's attention. They're going to backtrack and see, did you pick your last refill, or what is going on before you get a new prescription? It has to be monitored. All these things are done, and if they're done correctly, okay, then they give you a new prescription and you can go and put it in. And that is exactly what happened. The mom took her child to make sure everything was good, got the new prescription. Now, not a new prescription the day of, 10 days before. Mom turns in the specialty med prescription before it's needed, because she's aware medications can't be skipped. That's what was told to her. That's what's going on. Seems like logic to me. Seems like there shouldn't be any problem to me. Seems like there was no problem to her. So you put it in 10 days ahead and you get a call. Matter of fact, there's two prescriptions. You get a call back and the caller says, your prescription is ready, pick it up. You go down there. She went down there. That's what I'm still trying to share. Do you see me? Oh, I think I wasn't doing it right, people. I think I figured it out. I'll get it done for tomorrow. I know what's going on now. All right, so goes down there and gets only one medication. What's wrong? And the pharmacy says, your insurance denied the second medication. The second medication, the one I had to go to the specialist for to get, the one that they said had to be taken for the next 6 months, the one that they take labs about, that one, yep, it's been denied. So call the insurance company. No, the insurance company tells the mom, call that pharmacy and say, run it again. So she does it. Guess what the pharmacy says this time? It says your insurance has been canceled. I don't know if there's like a list of things that people say, like, I'm not really sure. They're just reading from a list, because if your insurance was canceled and you put in two medications, you should not have received any of them. Call the insurance company back and they said, well, perhaps it's the spelling of the child's name on the card, because all of the letters didn't come out. You should call the pharmacy and say, can you fix that? Now, that's not going to work for two reasons. First of all, if there's any changes, the pharmacy makes it. When they get ready to bill, the insurance company says, that's not our client. That's point one. But point two, the label says the child's name spelled out just fine. That cannot be the reason. Call back to the insurance company. Here's a new one. The insurance company says, Mom, ask your doctor to file an appeal. Like, this is member services telling her, call the insurance company to appeal. Your insurance is not canceled. Appeal the denial of the medication. Now, was it denied What does the insurance count? What really are we calling the doctor's office about? All right, but mom calls the doctor's office, gives the entire thing. The doctor's office says, I'll call. They call the mom back and says, the pharmacy says it's strictly an insurance problem. No appeal is needed for the doctor. Translation, they're checking out. The doctor's office is checking out. They're done. Okay, we made the call. So mom goes back to the pharmacy, says my insurance is not canceled. The medication is not denied. They do not need a pill. And the pharmacy says, okay, here we go. Just pay for the meds. Pay the $400 for the meds. And when the insurance clears everything up, you can get a refund. Really? Do you know that it is a fact that there's only $400 separating the average American family from bankruptcy? They are $400 away from bankruptcy. That's just regular. And you're going to take that $400 that is keeping you out of bankruptcy for medication. Of course you have. There's no choice, right? What do you, your child's life or where you live or where the child lives, now they're homeless. Now someone, what is going on here? What are you really being asked to do? What? It's a bunch of rhetoric. Hey, girl, how are you? Mr. It's ridiculous. But this is what they're being asked. Get your $400 out. Pay us, the pharmacy. And, then you get the money. You get the money back from your insurance company. So Angie's Pace is brought into the crisis situation. It's day 10. Now, the mom has done her thing for 10 days. It's day 10. The child is on their last thing of med. Now, here we go. Here's some facts. What's going on? Fact number 1. Medical care and medications that are part of the continuous care cycle must be continued, insurance or not. It doesn't matter, insurance or not. Yep, very sad. Okay. How many people know that? How many people know that fact? If you, let's just say, were to take radiation or chemotherapy, okay, they check your insurance when they say you're going to get it. They check your insurance when you come to that appointment. And again, before anything is mixed or done to you, they check it a third time because they know once they put that needle in your arm with that chemo, once you get that radiation, it cannot be stopped. When you are on specialty, anything, it cannot be stopped. And everybody knows that. The pharmacy knows it. The hospital knows it. The doctor's office knows it. Angie's Pace knows it. But you, the powerful patient, you need to know that as well. Here's the next thing that we need to know. Like I said, who knew the facts? The pharmacy, the doctors, the insurance. The mom knew it because they told her to keep doing it. But the people that could help her, she couldn't get anybody to help her. Not at all. So what did I do? I actually called all 3 of these again because I wanted to know, what did they say? I called the pharmacy. And the pharmacy says, well, in our system, I said, I understand all that. But do you understand this is a continuous care medication? Something has to happen. The pills have to get to the mom for the child. Well, I called the insurance company. Well, no, I called the doctor's office. They said, okay, well, whatever you need us to do, we'll do it. Okay, they're on standby. I call the insurance company. The insurance company says, well, what happened was there was an insurance cancel, but it was just a change. But the same day, a new one was put in place. Maybe the pharmacy is looking at the old one. I'll call them. I said, what can I depend on for you to do? To call me back? No, stay on the phone. I'm happy. Stay on the phone. They call. The insurance company gets back on the phone and says, the pharmacy says they don't see the second policy. So it must be a glitch in their system. Now, this has been going on for 10 days, people. 10 days. Okay. And they need to talk to their health desk. I'm talking to them on Friday morning, 11 a.m. It's specific time for both of us. That pharmacy tells the insurance company that their help desk has closed early and nothing can be done to resolve this. No medications until Monday. What are you talking about? The help desk of a major pharmacy is closed early on Friday? Well, why is it you can tell me the insurance is expired? Why can't you do all the other things? I said, let me stop right now because you know what's most important? Getting this medication today. So I called a total different pharmaceutical insurance, I'm sorry, pharmacy, and I asked an important question. Do you have this medication in your store right now? Do you have a 30-day supply right now in your store right now? Do you take this insurance right now? Yes, yes, yes. If I have the other pharmacy call back, will you take the transfer? Yes. Now, why did I want to do it this way? Instead of having the mom go and get the prescription, listen, this is what's happening. Why did it take 10 days? Everybody's working. You're on the phone. You're on hold. You're doing your job. It took that many days to get through every entity multiple times. She works several miles from home, but the pharmacy is close to home. I didn't want anything to go wrong, but I believed pharmacy to pharmacy, they can make the transfer. That's what I did. Do you know that the pharmacy, the one who the fault was, refused to call the new pharmacy with the transfer of medication? They gave me the prescription number and told me to call that pharmacy and have them call them. Oh, they know how to do it, and we'll do it then. I went on and did just that. And when I called the new pharmacy, they said, is that? Oh, we have to do that a lot. Yeah. Now, here's what the action is. The most important thing is the child gets the medication. But the next important thing I want to ask each and every one of you is, do you understand this, what I say every week? That excellent health care is not a privilege, it is your right. I still got the man, but men and women, let's exercise our rights. If you have been going to a beautician for 15 years and your man, you, the weather, a vacation says, I need braids, and they don't braid, what are you going to do? You go to somebody who does braids and you do not hesitate. If you want to weave, if you want to do weaves now and your beautician don't do weaves, what do? You leave them and you go and find somebody who's doing weaves. So here's the question. Hey, Ms. Fan, thanks for sharing. Here's the question. If your doctor, okay, your pharmacy, your health insurance is not taking care of you, where is this whole loyalty factor coming from? You left the beautician, you'll leave the barber, you'll stop eating at a restaurant. What kind of pledge are you doing about your life? Listen, when you find out that diagnosis, that one that makes you fall back, do you really want to be in collaboration and partnership with people who will not help you get Tylenol off the counter? Is that what you really want? When your child has to depend on what is being given to them, and let's face it, people, this is prepaid medical. You've already paid your monthly fee and you're paying everything else. And now you can't get someone to cooperate with you and someone who knows that this medication cannot be stopped. They know, the pharmacy knows, the doctor knows, the healthcare insurance, everybody knows. And guess what? You know. But they keep asking you to be the person to be responsible to get done what you've already paid for them to do. Excellent health care is not a privilege, it is your right. Go to your portal, people, and look at your exclusions. Maybe you can't get out of it now, but you're going to know before the emergency hits, you're going to know what has to be done. This is an epidemic that is going on in America, ladies and gentlemen. This is what's happening to us. People are leaving this world not because they have to, but because they are not strong enough to fight. Because the people they're related to are not strong enough to fight, because they're sick themselves. They don't know about me. They don't know about what to do as their own advocate. And so for 10 days, they are asking, they are requesting, they are putting in, almost begging someone to help their loved one for what they've already paid for. If you will not allow your beautician to decide whether or not you get braids, please do not allow your health care insurance. Do not allow your doctor to decide whether or not you're going to get a second opinion. Are you kidding me? You get a second opinion because it's prepaid medical and it's your absolute right. Absolutely. If it doesn't sound right, if it doesn't feel right, it's not right. You're not going to the fast food restaurant and eat no tomatoes if you're allergic to tomatoes. You're not going to take that burger. You're not going to have some sauce that's going to break you out in hives, no matter what the restaurant is. But you're going to collaborate and be in partnership with your physician because you've gone there for 15 years. And when you need that medication and you can't get it, and you have to go and get the pharmacy, the doctor, what is going on here? What is happening? Listen, when you're looking at your loved one and it's like, no one will help me, I'm asking you to, first of all, help yourself. If there's something you can't help yourself with, what do I say every single day? I'll say it again for you. Here it is. You could speak with me. If you're not getting the results, call me, Advocate Angie. Schedule a time at the Bitly link. It's very simple. The next thing I tell you is go to my website so that you can learn more about Angie's Pace and the services that we provide and what we're doing. And most importantly, listen, you need to get this book. You need to be a powerful patient. What you don't know could kill you. It's not about how to get out of the hospital alive. It's how to stay alive and not have to go to the hospital. That's what this book includes. It's July 1st, people. Let's reset. Let's reset on what our health. We're not going to eat all that stuff. Even though this week, come on, it's blood pressure week, rib bones, pork sausages, spicy. Please be careful of that. But more importantly, let's reset on our healthcare journey. If someone's not going down the road you're going on, get off that road. Get on your own road. You can make a path to excellent healthcare yourself. You do not have to be at the mercy of your pharmacy, at the mercy of your physician, at the mercy of your healthcare insurance. So I'm asking you to make this important decision. And the important decision is if you're not getting the results that you need and want, you should schedule at Advocate Angie at the Bitly link. All right, it's Happy Monday anyway. It's July 1st. We're resetting. It's the beginning of the fiscal year. I thank you for joining me. I'm Angela McGowan, your professional healthcare advocate, and sort of fussing today. Yes, I know. But I help you navigate through healthcare's sea of red tape, and I create strategies. Yes, have something to drink today. That allow you to give excellent care to those that you love and care for as you care for yourself as well. And I'm leaving you with two things. That's right. Blessings and joy. Why is that? Because they both belong to you. I will see you again on tomorrow. We have more to talk about. What happens when you get out of the hospital and you go to skilled nursing and skilled nursing is doing nothing? You get home and healthcare is doing nothing? Lots for us to talk about this week. Remember, healthcare is not a privilege, it's your right. Everybody, starting today, go out there and exercise your right. I'll talk to you again on tomorrow. Bye.